Baldvin McKenzie, Parish Manager, SDC, Clarendon, and also the co-chair of the Clarendon Interagency Network. Parish Interagency Networking Program is one of the 7 programs of the SDC. What is an interagency network? It is a mechanism at the parish level that supports effective collaboration of service providers for efficient and targeted quality service delivery. But we have 3 core functions. 1, promote and maintain capacity building for 13 parish interagency network across the island, and also to promote strong linkages with the local authorities. The second one, look at coordinate, organize and coordinate joint intervention across all parishes. Monitor, implement robust monitoring and evaluation framework, which is very critical. What is the strategic position? Well, our parish interagency link our program objectives. Parish is to improve the quality of service delivery to residents through effective, efficient collaboration among service providers. Now we look at Clarendon. In Clarendon, our network, the name of it, Clarendon Interagency Network. We have a governance structure where the mayor is a co-chair and the parish manager of SDC is the other co-chair of the network. At the administration of this network is we have the mayor's secretary and also the SDC parish administrator. They are the ones that do the secretarial duties. And from time to time, we establish subcommittees to address issues emerging out of our meetings. So far, over 25 ministries, departments, and agencies and service providers are involved in our interagency network. And I can tell you, the community is well represented at this interagency network through the Parish Development Committee, along with the business sector through the Chamber of Commerce. But what is the main focus right now? Coordination is one of the major pillars of this interagency, as it creates an avenue for MDAs and other social services providers within the parish to work together to coordinate on collaborative ways. Few years ago, each agency do what they want to do whenever they want to do it. What is happening here in Clarendon, we are working together as one. All this is done through our monthly meetings. Issues and activities are shared and plans put in place for intervention in communities with an entity identified and agreed on to coordinate these activities. If you don't have somebody, some institution to coordinate, you're going to have a problem. And that's what we ensure we do in Clarendon. All our activities, there's a lead agency that coordinates the activities and other organizations give support to it. This approach is critical to the delivery of service to the public or to the clients within the parish, as it prevents overlapping, resource mobilization, and utilization of maximum benefits to the clients, our target groups, and easy access. I can tell you, when we're moving into a community, you find 6, 8 agencies moving into one community at the same time. I can tell you, the residents are very happy for that sort of approach. Now, with the COVID-19 pandemic is approach us in the island, the interagency immediately met and said, listen, what can we do as an agency, as an interagency network? And out of that, we have developed a strategy that as a parish, we must work together. And this is where this intervention was one of the many interventions that demonstrate the benefits of coordination. Multi-sectoral approaches were used. We have a number of agencies and institutions that give support to this, but guess what? If you do not coordinate the effort, you'll be in trouble. And therefore, the interagency pulls together all the agencies and develop a strategy as to how to engage our communities. This is where the Ministry of Health, through the Clarendon through the Clarendon Health Department, they lead that process. Today, we are very proud to say we have a robust intervention strategy plan for Clarendon as it relates to COVID-19. And in COVID-19, there were many activities that we carried out. We have tone cry services. If we do not coordinate that, you will find that the tone cry are going to one ear and don't go into the other. So coordination is important. We use the physical interventions in communities in a strategic way. We use our WhatsApp group to share information. And we also utilize the social media platform to reach persons within these communities. I can tell you, in the last 3 meetings we had where the Ministry of Health reported that there was some upsurge, there was some increase in community spread in COVID-19, and therefore the agency, we all met as an interagency group to say what can be done. And out of that, we organized intervention in all those communities. So in closing, coordination allows for maximized resources, easier access to social services, increased benefits, share resources. There are times when we all travel together into the community. I will drive, I will offer a ride to another agency. This is how we do it in Clarendon. And result of that, we found that the implementation of the various agencies program, it is more effective. It's reach out to the people who are in need. And therefore, we are very happy that the interagency in Clarendon is able to pull together all the players, not just the MDAs, but also the service providers, the business sector, and our NGOs. Once again, I just want to say, coordination and collaboration are at the forefront of the parish as we contribute to the achievement of Vision 2030 Jamaica. Thank you.